Welcome to Flourish Well, the wellness podcast where we explore what it truly means to live healthier, move better, and feel more grounded in everyday life. I'm your host, Naomi Dillon, and each month we shine a spotlight on a different dimension of well-being, from physical health to emotional resilience, stress, relationships, and everything in between. Today we are joined by Elizabeth Allen. She is an art therapist and a mental health counselor who helps people navigating life with a chronic illness. She brings a unique perspective as she has her own lived experience with her own diagnoses. When she is not seeing clients at Creative Pathways Counseling, she is expressing herself through art, snuggling her dog, or reading a great book. Let's dive in. Thank you so much, Elizabeth, for joining us on Flourish Well this month. So excited to talk with you about therapy and chronic conditions.
Thanks for having me. I'm excited.
Yeah. Awesome. Cool. So our first question here, my experience in clinic is that I don't think people often think of counseling as an option for physical diagnoses. Mm-hmm. What have you found prompts people to seek therapy related to either a new diagnosis or a diagnosis that they've had for a long time?
Yeah, so I think you're right that most people, that's not their first thought. It's usually let's go to a doctor's, PT, OT, whatever the other therapies are. And usually I feel like mental health therapy is kind of last on the list if it's even considered. But I think in my experience, having all of those things hand in hand is so helpful, right? Mm-hmm. And even sorry, I'm not answering this question, but I have experience in grad school being in placements where I was doing art therapy in rehab settings. So watching the impact of someone's coming from PT to speech, and then they're coming to the art therapy studio and they're kind of getting a full wraparound care. I mean, it's just really cool to see that. I think it makes such a big impact when they have that. But in terms of coming to outpatient therapy, I think usually it's whenever we see some kind of big changes. So if there's an increase in symptoms, like new flares, new symptoms, things that just they weren't really prepared for. So maybe that is a new diagnosis. Could also be hospitalization, surgeries, things that feel really big and overwhelming. I think a lot of times it is waiting to a point of, now I'm really, really anxious. Now I'm really depressed. So now I need therapy. And sometimes we let it get a little bit further than maybe would be best case scenario. I think if we seek out therapy right away, when that stuff is starting to build, we're going to see faster, better results. But sometimes I do think it tends to be well, now my anxiety is a 10 out of 10 every day. I'm having panic attacks. I can't function at work. I can't relax at night at all. I can only focus on my symptoms or my pain or whatever I'm experiencing. That's usually when someone decides to go to therapy, specifically when it comes to a diagnosis or chronic pain or whatever it might be.
Yeah, and that makes a lot of sense to me. It sounds like it's with a big stage of maybe grief, right? Like getting a new diagnosis, coming out of the hospital, a major physical change that really affects their life, or waiting until things are really bad to go. And I find that in my the times that I end up referring to therapy is when somebody's in my office and we're talking and we're going about session, and there's a lot of perseveration, for lack of a better term. We're just really focused on, well, this is my pain, and very vigilant about symptoms and everything. And that's where I go, And then of course add in oh, my family situation is blowing up, or there's a major change in a relationship that's important to me, whatever, add that in. And I'm okay, so I have a psych minor and I can't really help you with that. It's time for you to see a professional like Elizabeth, who can help you manage what's going on, because this is I'm happy to listen and validate, but that's all I got,
Yeah, for sure. I think that is, and we see it a lot, is there's all of these different layers that add up to a bigger picture. There's always I never see someone come in for just chronic pain or chronic illness. There's always 5 to 10 other things happening in their life
Mm-hmm.
too that are stressful or overwhelming or big changes. And it's interesting. We're talking about this in relation to like a diagnosis or symptoms, but I think another thing we might see is someone who is navigating a lack of diagnosis, who's been
Mm-hmm.
for months, maybe
Mm-hmm.
even years, trying to understand what's going on in their body, and maybe they've been to doctors and no one knows. And there are a lot of chronic illnesses that at least from my knowledge, like do take a long time to be diagnosed. Endometriosis being one of those, average of 7 to 10 years for diagnosis.
Mm-hmm.
But thinking about other things as well, like chronic fatigue syndrome.
Mm-hmm.
I feel like
EDS. Yeah.
autoimmune are a
Yeah.
little bit more easily diagnosed because there's usually blood tests for those, but there are so many, yeah, EDS, MCAS, POTS, like all of the
Mm-hmm.
trifecta, I like to call them,
Yeah.
like all of those things where it's like we're adding up based on symptoms and not always we can run this test and 100% know. Those people, I think, tend to really struggle because you're waiting around and you're just living in pain, living with symptoms.
Mm-hmm.
And that's also, I think, a time where people tend to maybe seek out therapy is like, I don't know what else to do. Like, I need
Yeah.
to try something new.
Yeah. I need support. I need a different system of dealing with this. Yeah.
Yeah.
I've
Yeah.
had patients in the past too. I have one in particular that I'm thinking of who went in for endosurgery. They took a couple things, came back as standard tissue. And she was like, I just don't understand. Like,
Yeah.
I have all these symptoms. I don't know what this is. And I was
Yeah.
like, yeah, this is, I'm not saying this is all in your head. I'm
Yeah.
saying you need to deal with that, right? And like,
Yeah.
let's go seek out some therapy.
Yeah.
Cause I think physicians mean well when they are like, oh no, like you need to go see a therapist. And people can take that as you're telling me it's all in my head. No, it's not
Yeah.
all in your head. There's major changes that happen in
Right.
experiencing chronic pain that you need a little bit more help with.
Absolutely. Yeah. And like, it doesn't, I think physicians, some physicians tend to write off people's pain or write off symptoms. Like, well, all your tests came back negative. Like,
Mm-hmm.
are you sure this isn't just stress or anxiety? Especially women.
Right.
I'm sure men experience it too, but I think especially women, like our pain is invalidated, it's minimized. The messaging we receive from society sometimes is it's all in your head, we're supposed to just live with it. Period pain is normal, all these kinds of things. And so when you hear that from someone that you're like, okay, this doctor is finally going to help me, right? And then they're like, well, have you tried therapy? Like,
Yeah.
it does feel like, oh, are you telling me like that what I'm experiencing isn't real or it's
Right.
all in my head? And like, you are feeling it. It is real. But also, how are you coping with it? How are you responding to it? And that is where therapy can come in and like be another tool in your toolbox.
Yeah, 100%. This is kind of a side note, but I think all the time there's a paper that was published in like 2017 in one of the PT journals that talks about low back pain, chronic low back pain. And they have this incredible web and pains at the center, and then it has 200 different factors that are talked about in the literature as things that can affect pain. And some of those are community engagement, like what are your relationships like? Are you happy at work? Like,
yeah,
it's crazy to think about that, right? Is like affecting your pain, but it affects your nervous system. It affects your like outlook, right? So like,
exactly.
why would it not?
Yeah.
Anyway.
No, it's all connected. It's
Yeah.
really all connected.
Yeah, crazy. Okay.
Yeah.
So the big ones for that question are big changes, hospitalization, lack of diagnosis, or when things are just like way too overwhelming.
Yeah.
Yeah, makes sense to me.
Yeah.
What are some ways that you've seen therapy help with physical symptoms?
Yeah. So I think first of all, like I, try to be realistic. We're not curing someone's chronic pain by talking about it.
Yeah.
We can definitely help it, but I think just setting that as like a fair expectation, we can definitely make an impact on it. But I think it's more so I like to focus on like how are we managing your symptoms and your response to your symptoms. So definitely just like, you know, you don't always have a provider that sits down with you and is like, let's map everything out. Like, what are the symptoms? What are the triggers? Like, is stress a trigger? Is anxiety a trigger? Maybe not, but
Mm-hmm.
let's like map it all out. Let's track things. Sometimes we don't have a good system for doing that. So that's, I think, always a good place to start is like figuring out what's going on. And then a big area is really, like I said, kind of what's the coping system around the
Mm-hmm.
pain or the flare or whatever the symptoms are. Um, so, you know, if someone tends to have a response of anxiety, fear, panic, maybe even like hypervigilance, hypersensitivity, right? Where it's
Mm-hmm.
like my body has learned that pain is something I need to like respond to urgently, right? It's
Mm-hmm.
going to have all these other impacts. You know, we learn that from experience and that
Mm-hmm.
adds up over time. But I think that helping a client slow down and like, let's really examine what actually happens in your body and your mind when the symptoms happen, right? Again, we're not making the symptoms go away, but we're figuring out maybe a different way to respond to them.
Mm-hmm.
I think also a lot of people with chronic illness get stuck in like a self blame or even like a shame spiral around symptoms. You know, maybe we're on a really good path and then we have a flare. That's always going to happen with, you know, a lot of chronic illnesses. There's always flares, right? But
Mm-hmm.
for some people, it is, what did I do wrong? Or how could I have done something differently? And really, maybe there was nothing they could do to avoid it.
Mm-hmm.
So I think that's another part of it too. And again, like all of this makes your physical symptoms worse. If you are
Mm-hmm.
self blaming and shaming yourself, you're not going to feel better, that's for sure. So, kind of working through all of those different patterns of how we respond. Um, you know, I also would say like stress management. Again, stress is a really big trigger for a lot of people.
Mm-hmm.
That's something we can work on. And our relationships with our bodies are really important, as you know, as a physical therapist. Um, and I think that's a really great area for PT and mental health therapy to partner because,
Mm-hmm.
you know, we're all talking about the somatic system too. Like
Mm-hmm.
it's not just physical therapy, it's also mental health, right? Because
Mm-hmm.
how our, even the language we use to talk about pain, my body's mad at me, my back's mad at me, like things like
Mm-hmm.
that are
Yep.
a lot of times the way people with chronic illness will describe things.
Yep.
And I think that's just such a clear example of, you know, the relationship with the body is totally disconnected. It's totally
Mm-hmm.
off. So doing some somatic work, things like that, and then also just like what are our coping skills that we have in place when we're in pain or when a flare happens, um, and what are our support systems? Who are we leaning on? Who are we
Yeah.
turning to? All of those kinds of things are all, that's all stuff to talk about in therapy.
Yeah. And I think that's a great that's really helpful to give people because like people feel out of control. Like you feel out of control when you're in a flare, right? And
Yeah.
so my job is to give you here are three things that you can do
Mm-hmm.
during your flare that like will hopefully help to turn some of those symptoms down.
Yeah.
And your job is, hey, here's the five step system that you can employ or whatever, you know.
Yeah.
Can you text your like best friend and say, hey, I'm not feeling great. Can we chat on the phone or whatever, you know,
Yeah.
like whatever it is you come up with because it's patient specific. But like
Yeah.
that helps you regain some sense of control.
Absolutely.
Yeah.
Yeah. I like that because control comes up so much with so many
Mm-hmm.
of my clients. I work with a lot of people who not only have chronic illness, but also are generally anxious people. And
Mm-hmm.
at the root of anxiety, a lot of the times is what is within and what is without of my control. And sometimes even
Mm-hmm.
just recognizing, okay, maybe I can't even make the pain go away right now. Maybe I've tried everything, all of the skills to help with the pain, and it's not budging.
Mm-hmm.
What else can I do that's in my control? I
Yep.
can call a friend. I can get a sweet treat. I can,
Yeah.
whatever the things
Right.
are that like
Mm-hmm.
just help you even the littlest bit. It's like,
Yep.
let's take a little bit of that like edge off of the stress and
Mm-hmm.
anxiety that comes with it.
Mm-hmm. 100%. I don't use the word pain very often. Like
Mm-hmm.
I try and really limit it. Like, my patients know I'm a girl who says spicy. Right?
Yes,
Like we both know what that means, but oh, your hip's feeling a little spicy. Okay, heard.
I
Like
love that.
it's feeling a little chatty. It's got thoughts and feelings.
Mm-hmm.
Like those are my common things to
Yeah.
say, right? And I remember being in school and thinking that it was so goofy for the research to call it bothersome, like to call
Mm-hmm.
symptoms bothersome. But that's a better word. It's a more neutral word in a sense, right? It gets the point
Yeah.
across of I'm bothered by what's happening and it's
Yeah.
not comfortable, but we don't have to sit here and like, oh, you're in pain. Oh, you're in pain. Oh, you're in pain. Like
Yes.
thinking on that constant loop. And then also finding ways for people to be confident in their body in some way, shape,
Mhm.
or form. Because it's
Yeah.
definitely a lack of trust, right?
Yes. Yes.
And so that goes back to the control thing that we just talked about, right? Is like,
Yeah.
okay, here's something that I can do that I feel is completely neutral.
Yeah.
Neutral's
Yeah.
great. I love neutral.
Love neutral.
Love neutral.
Absolutely. Yeah.
Yeah.
And you're making me think about, so I do EMDR as well.
Okay. Can you talk
And
about what that is for a second?
yeah, sorry. Yes.
No,
Thank
you're
you.
fine. Yeah.
So EMDR stands for eye movement desensitization and reprocessing. It is a trauma treatment modality that involves using bilateral stimulation to help the brain and the body process through past traumatic memories. It can help with a lot of things, though: anxiety, OCD, depression, you name it. It's
Mm-hmm.
probably helpful.
Mm-hmm.
And there is actually, I think there is a lot of research on how EMDR is. It is known to be statistically positive. It helps
Mm-hmm.
people, but it can also help with chronic illness as well. So that's just another
Hmm.
tool to kind of throw in there. And
Yeah.
sometimes I do use that with clients too, is like processing through the pain, processing through the past experiences of pain,
Mm-hmm.
medical trauma, hospitalizations,
Mm-hmm.
all of those kinds of
Mm-hmm.
things. But I thought of that when you mentioned neutral, because it's all about shifting from, our automatic negative ways of thinking, negative belief systems, to positive or neutral belief
Mm-hmm.
systems. And I think that really applies to chronic pain, chronic illness. Is, we're not going to be toxically positive. Like,
Mm-mm.
toxic positivity has no place here.
Nope.
It's not going to work. It's not realistic when you are actively in pain, that you're just going to be like, oh, well, no big deal, right? It's
Yep.
like, okay, I am in pain. I am living with this. That sucks.
Yep.
And also, what can I do? Like, what is
Mm-hmm.
that neutral thought process? Or even maybe there is time for positives there, but
Yeah.
that shift can be really, really helpful.
Yeah. Yeah. That's reminding me of another like piece of what I feel like our combined job is, which is
Mm-hmm.
I've had patients before who they feel like they hit a wall, right? And they're like, I
Yes.
just don't think I'm ever going to get better. And I'm like, look, I'm holding on to your hope for you, so I'll keep
Yeah.
doing that, right?
Yeah.
And your job, we're just getting through the day. That's what we're doing, and that's
Yeah.
fine.
We're in survival mode.
Yeah. Right.
And I get that. Like, as someone who also has my own chronic stuff, it's like
Mm-hmm.
sometimes I can't even hold my own hope. That
Right.
doesn't mean I'm still holding hope for all my
Right.
clients, but
Right. Exactly.
sometimes I can't even hold it for myself, and I
Yep.
do just need someone to
Yep.
keep pushing me, keep encouraging me, know
Yep.
that someone else believes that it can get better for me, because that does really make a difference.
100%.
Yeah.
100%. Yeah. And then going back to the first point that you made, which was data gathering.
Mm-hmm.
I talked about this with Dr. Chadwick last time, and this is a really helpful thing to make your doctor's appointments a little smoother.
Yes.
Because physicians love data. They love data points, right?
Yes.
And it can be a little triggering to track data points for
Yeah.
people's anxiety, but
Mm-hmm.
and I'm sure this is something that you work with people on, is like how to find that balance between the like, okay, is this
Yeah.
helpful or is this causing more problems? But how can we take this data and then bring it into a doctor's appointment? And how can you advocate for yourself a little bit more easily with this information that you've gathered?
Yeah. I think the advocacy part is so important there. And,
Mm-hmm.
for one, I always encourage clients, like, when we have a doctor's appointment coming up, like, what are your goals for that appointment? What do you want to get out of it? What questions do you need answered? Let's go in with a note in your phone that you can look at and be, or, maybe you want it handwritten, but have it in front of you and say, here are the things I want to ask, because if you don't, you're going to forget in the moment. Doctor's appointments are really stressful.
Yep.
And the same goes for the data tracking, right? Like, if you don't have that information in front of you, you're not going to remember. This is something I have a hard time with too, is like, if I'm not actively tracking my symptoms, I can't even remember a week ago, how was my pain? Like, I don't know. I can't remember.
So I'm feeling good now.
Right. I can remember today and yesterday, and that's about it. So yes, writing it down is important. I have used an app for tracking. I have not used it consistently, to be honest, but I think sometimes that can be helpful too, is just like, the responsibility isn't on you to worry about, am I writing this all down at the right times? Am I checking in every day? Because it gives you a notification and asks you to like do your morning and evening check-in. So something like that simplifies the system a little bit, so that stress isn't on you as much. But it's also different for everyone. Like, maybe I don't need to track everything. Maybe I just need to track 1 to 2 certain metrics, and that's enough. And I don't need to track 10 different things every day, because that feels like a lot.
Right. Yeah. I've two things on that are coming to mind. Is one, I remember seeing a PT online having one of his patients come in with a calendar that she had printed out, and then she was just highlighting, this is a bad pain day, like literally with a highlighter. And then like what activities she did that day. Those were the 2 things she was tracking. And something that I think is interesting from that post, but I think that could also come up in this, is as you're progressing, right? If things are improving, right? This is another good exercise to like kind of prove to yourself, like, hey, I am doing better. Like, here's June of 2024 and here's June 2025, okay, there is improvement there, right?
Absolutely.
So I love data. I love it.
Yeah.
And then the other thing that I'm also thinking of is I have patients fill out like bladder diaries every once in a while, because I see people with bladder pain or issues like that.
Yeah.
I've had many a patient who's like, oh, I'm just going to keep going. I'm just going to keep tracking, because it does give them some sense of control, right? But
absolutely.
At the same time, I don't want you perseverating on what is going wrong in this situation, right? Like, okay, we got the data we needed. Now we don't need to like focus on that in the same capacity. We're going to focus on implementing other things into our plan.
Yeah. I think that's such a like hard balance to find in a way. And again, it's so independent, like for each individual person, what works and what doesn't work. For one person, that might feel really overwhelming, and for someone else, it might feel like it gives them control. So I think it's all about like, let's try something and then let's check in and measure it and see how that feels. Like, did that feel overwhelming, or did that feel good and accessible to you? So I think it's, I am so, just as a general rule, I tailor everything to every individual as much as possible. And that means I'm having, 15 different sessions doing completely different things every single week.
Yes.
And that's totally fine, because I'm meeting each person's individual needs. Right. So it's all about like what works for you.
Yep. 100%. Love it. Okay. So we talked about, the physical symptoms. We're not curing them in therapy, but we're able to come up with strategies for tracking them, managing the response to symptoms, which is huge, building a coping system, and then using that to help manage the shame spiral that can happen for a lot of people, and help with the stress management and the lack of control. Yeah. Love that. And that's all of those things are so huge, and they're all things that I am not trained in doing that are so helpful for people. And this is why PT and talk therapy are like this in my mind.
I agree. Can I add one more thing to that list too? Is like, especially for people with fatigue, I think that's a huge area where, like with certain clients I see, we're checking in about it every single week. It was like, I tried this thing and then I felt really, especially people who have like post-exertional malaise, like things like that, where like it hits you 24 hours later. And so I do a lot of talking about like spoon theory. I'm sure you're familiar with spoon theory.
Yes.
And like, okay, if we are low on spoons today, how are we rationing those? Let's say I have something big coming up tomorrow. You know, what do I need to scale back on today so that I can make sure I have enough energy to do that thing that I'm really excited about? So granted, I know not everyone has the ability to make those decisions. Some people, you know, they're working 40 hours a week and they have to do certain things, or they're a parent or whatever it might be. But people who have that ability to decide, what can I put on my plate, what can I take off my plate, I feel like that's also an area where therapy can be super helpful. And that is truly making an impact on the fatigue in the long run.
Because it somehow seems that all the people with chronic illnesses also are people pleasers. So.
Yeah, this is true.
We gotta find some balance in that.
Yeah, and just setting realistic expectations for ourselves. Like, you can only keep doing the same thing over and over so many times before it's like, okay, the system's not working. Like, let's try something else. And it is hard to do that, especially, like you said, we tend to be people pleasers, but also high achievers, perfectionists, like people who will burn themselves out. And I think that's where it's, you know, a therapist can jump in and say, I hear you reaching some burnout. I hear you reaching some chronic illness burnout or really intense fatigue. Like, what changes do we need to make now? And I'm pretty direct when it comes to that conversation. I'm like, you know, I'm realistic. It's like, we can't do everything. So what do we need to take off your plate this week?
Yep. And that's huge. That's really huge. Speaking of self-advocacy, how do you help your clients manage fatigue of constantly having to retell their story to the 18th person for the 18,000th time? And also how to balance that with like asking good questions or not being overwhelmed in the moment and forgetting, you know, when they're going through a period of a lot of back-to-back doctor's appointments. How do you encourage people on that?
Yeah, this is a good question. It's come up a lot recently, I will say. I have been running endometriosis support groups for the past 6-7 months.
Which is so critical. Thank you for doing it.
Of course, absolutely. And something I've noticed in there is, and in my individual therapy clients, is a lot of people come to me because of that. They come to me because I have endometriosis and they want a therapist who they don't have to over explain themselves to. They can mention a symptom offhandedly and I'll be like, oh, I know what you mean.
Same girl.
And they don't have to like over explain it or answer 1,000 questions, right? So first of all, I just want to put that out there that if you can find a therapist that actually has lived experience with your chronic illness or maybe one that's somewhat similar, that can also help with this process of always having to explain your story over and over. I think that with this question, again, like going back to preparing for doctor's appointments, having your notes in front of you. I mean, if you can get around having to re-explain everything every time, that would be great. If our doctors could talk to each other and all of that would be wonderful. And maybe that is like connecting a therapist with the doctor, with the PT, like let's all link up and be able to talk so that the client doesn't always have to do that. But if we do have to, I think I really fall back on like when it comes to advocacy, like what are the past patterns and experiences with advocating for yourself? Because a lot of times I think there's some trauma around that. If you have medical trauma already, if you haven't been believed in your pain, that's somewhere I would start because just exploring that first might be really helpful. I think also I tend to operate from a strengths-based framework. I talk a lot about values and value systems. So that's something I would think of for that too is, you know, what are your strengths? What are you already good at doing when it comes to telling your story, advocating for yourself. How can we expand on that? So maybe someone is like, this is just a hypothetical, but if someone's a really good writer and they actually freeze up when they try to tell a story, like, can you write it down and hand it to the doctor or send them a message or something along those lines?
Give it to the MA. Yeah.
Take away a little bit of that stress, right? And I think always just like, what is important to you to get across? What matters to you in this situation? Let's role play. Like, let's talk through what that's going to look like when you do it. I think every conversation you have, there might be a different message you want to get across to different providers. And we can talk about tools and ways to communicate that. And working on confidence, I think, as well. And feeling really secure in yourself to be able to advocate, because it's hard at first. I think a lot of us with chronic illness get really good at advocating for ourselves because we feel like we have to. But that's another huge area that I would say can be, playing more of a role than we think it is.
100%. And what about the same thing with questions, I'm guessing, is, like, what questions do you have going into this appointment?
Yeah.
And if you, like, one I run into a lot is I had a patient last week who asked me about this. Like, hey, I don't know, should I get an injection this week or should I wait? Or like, I'm like, hey, I know a couple things. I don't give injections. Yeah. I would recommend you message that doctor. And they're like, oh, okay, great. And oftentimes physicians will get back to you. Not every time, but like, that's something you can throw in the portal and then you can even double check, okay, if they didn't answer, great. I have an appointment with them in a month. I'm going to think about, checking in on that.
Yeah. And on that note, like, finding the right providers.
Yep.
Maybe you are someone who needs to send a message every week and do a check-in with the doctor, and maybe the doctor you have isn't, someone who responds, and that's okay, but maybe then that's not the right fit.
Right.
I know with more specialized care, like, we might not have as many options, but it might make all the difference to find someone who's really gonna meet you where you're at. And that doesn't mean that first doctor wasn't a great doctor. It's just maybe not the right one for you too.
Well, that's a huge thing as well, is finding the right fit in general. I'm never offended when a patient's like, well, I don't know. Like, I don't know if I'm getting, okay, great. I've got a million other people. I got people. We can find the right person for you. If it's me, if it's somebody else, if it's a different doctor, I got people. I'm willing to do some digging for you. Like, that's fine, because everybody deserves to find their right match, as best they can.
Exactly.
Yeah.
And sometimes, there's that invalidation that happens too. And like that, we don't want to see anyone who's invalidating our pain ever. Yeah, right. I'm not a fan of that.
Nope.
And so finding even someone who just has like basic listening skills, like I think I know it sounds silly, but there are so many doctors that don't.
Yep.
And I'm relatively picky when it comes to my doctors, and I love my primary care because she's just like, yeah, it sounds like that's really hard. And I'm like, that's the most basic empathetic response another human can have. But you are, a lot of offices, you are in and out 15 minutes, if that, like, they are getting you out the door. There's no time for that person to sit with you and really listen. And when you find someone who does, it can feel really different.
Yeah. 100%. Yeah. And that's it. It seems like most young doctors are starting to make that shift. Like, I feel like as the older generation retires, like, it seems like people mid-age and younger are doing a lot better at that. So hopefully that continues, as long as overwhelm doesn't take over the system. But that's a discussion for another day. Love it. So finding a provider with lived experience, because that's very helpful. Finding someone who's a good listener, if you're looking for an MD or a PA or, an NP, something like that. And in general, and then prepping. And I love the idea of role playing too. Like, that's like, if you're comfortable doing, like, if you're in therapy, doing that with your therapist, but also, ask your partner, ask a friend, like, hey, I have a couple questions. Can we go over them and see if you have anything else you think of
Yeah.
that might be helpful if they understand the situation,
Yeah. Absolutely.
Love
Yeah.
it.
I have like, I feel like this has come up recently where I've had someone who was like, they'd been doing physical therapy for a long time. And they were like,
Mm-hmm.
do I want to keep doing this?
Yeah.
I'm not sure. And I was like, okay, well, let's explore how you feel about either route.
Mm-hmm.
And what do you want to get across to your PT when you have that conversation with them? And then I wrote down a list and I sent it to them. And I was like, here's all the reasons we talked about. Here are all the things you want to ask.
Mm-hmm.
Your words.
Right.
So then you have it in front of you.
Right.
So that's something I like to do too, is like, let me help translate your thoughts and your feelings into what the questions and actions are that you want to take.
Yeah, 100%. I love that. And I will also say, as a note on PTs, 99% of us want to do what's right for you.
I believe that.
And so if you have an honest conversation with us, you're not offending us.
Same here.
Right, exactly. Yeah. So just, and I'll watch that happen on people's faces where they're like, yeah, I don't know. And I'm like, okay, you can tell me it's bad.
Yeah.
In fact, I need to know if it's bad, because then I need to change plans. Like, we need to shift gears.
Yeah.
So don't be afraid to say that to a provider.
Yeah. Agreed.
Yeah. All right. What kind of boundaries do you help people establish with their friends and family? This is a toughie.
Yeah. When I wrote down my notes for how I was going to answer this question, I started with, oof, boundaries are so tough. That's what I wrote in my notes. So
I love that.
And that tells me how I feel about it. First of all, I just want to say, I think boundaries are something that are kind of a pop psychology term right now. So let's just remind ourselves that it's way more nuanced than what is being spoken about out there. And people are saying, this is my boundary, and maybe it's not actually a boundary. So there's more of a conversation. That? Yeah. I mean, I think, at least what I'm seeing, and I watch a lot of reality TV, so
fair, same.
Partially coming from that.
Yeah.
I think there's a lot of like, especially, I'm technically Gen Z. I think my generation is very like, we all think we're therapists. Obviously I am one, but I think a lot of people like think they have all this knowledge and they're really empowered with it, and that's awesome. I love that, but it's also, I think there's so many things that are super nuanced and are just kind of blown up, and boundaries is one of those where I think people will just decide, well, I want things to be a certain way, and so therefore that's a boundary, right? And your boundaries need to be about you and how you yes, they can be about how you want people to interact with you and support you and all of those things, but you don't get to set boundaries that are deciding or controlling what someone else is doing. So I think that's where things get muddy, and
definitely
it's an overused term now. However, boundaries are very important, and I think people with chronic illness definitely get that in a different way, because maybe there are different boundaries that need to be set or we would want to set. So I think some of the things I think of, again, especially for perfectionists, people pleasers, anxious people, it's really hard to set boundaries because, we, for whatever reason, have patterns of allowing people full access to us, saying yes to things we really want to say no to, all of those types of things. And then if you develop a chronic illness, maybe a new one, or you have a new diagnosis, everything in your life can change in a pretty short period of time. And something else that needs to change is the boundaries. So again, I come back to like, what do you value in relationships, and what's important to you in the relationships you have in your life? And then once that framework is established, all of our decisions that we make about relationships, boundaries with relationships, should be aligned with that. right? So sometimes that's having someone you can ask for help, right? Friends, family, significant others. Some people really struggle with asking for help, so figuring out a system that makes that easier. Um, that's a type of boundary. It's kind of in the other direction, but I think also just like being really clear on your wants, your needs, having a really good communication system is part of that. And I think there's a huge part of this that's educating the people in your life. And maybe that is more of a firm boundary we want to set. So if someone's not understanding and you've tried to explain to them multiple times, hey, I have this diagnosis, or I'm having chronic fatigue or chronic pain, and here's how I need to be supported, and that's not lining up, then we would think of maybe, okay, this person is like, they're not trying, right? Maybe we want to redirect them. Like, I think a really solid boundary for people to set is, hey, it's really exhausting for me to keep explaining over and over how my illness is or how my pain is. Could you do some research on your own? Here's a resource, you know, something else you can read, a video you can watch that will explain more. Here's what endometriosis is. Here's what Ehlers-Danlos syndrome is. Like, can you read that on your own? That'll help answer some of the questions maybe you have, right?
Yeah.
I think that's the biggest one I think of, is when someone just doesn't seem to want to understand. I think, again, going back to the pop psychology thing, there's a lot of, recently, I think there's been a lot of people going no contact with family members and things, and I'm all for that if that's the right move for you and if that's what you need to like protect your peace and be well, and you know, if that's not a positive support system. So I think that is something to think about, is like, how much access do you want to allow certain people to have with you? Maybe if you're chronically ill, you have less space in your life, you have less time and energy to give to relationships. So maybe you have a partner and then you've got a solid friend group. That might be all you have space for. So
yeah. And I was just gonna say, it sounds like this is to maintain a relationship that's important to you.
Yes, absolutely.
Because this isn't, I mean, you know, there's like random acquaintances, I feel like, who sometimes check in via text, and it's like, no. Like, those people, like, you know, maybe there's some other kind of like blanket response that they can get, you know, but for people that you're interacting with regularly, that's a huge ask. And like, it's tough, and they need to take on the humility and say like, okay, you know what? I have been asking you a lot, and I can do my own research because I care about you.
Yeah, exactly.
Yeah.
And we don't want to explain ourselves all the time. Like, that's really exhausting. Maybe just telling someone that, hey, you've been asking me a lot of questions. I appreciate that you care, but it's really exhausting for me to always have to explain myself. Like, can we establish a different system for that check-in? Because this is not feeling really supportive, and I know your goal is to support me. So let's think about it differently.
Yeah, 100%. Love that.
Yeah.
And I also love that you gave like a blanket response, like a good like summary explanation, because it is so individual.
Yeah.
Right? Like, you know, not everyone's mom is going to be the problem. Not everyone's father is going to be the, you know, like there's every situation is different. And actually, even within each relationship, there's a lot of nuance too. So like you said, maintaining that nuanced position is huge.
Yeah, absolutely. And like, some people have amazing friends who've like done their own research and they're like, I'll take you to the hospital if you need to go. And then other people have like, oh my gosh, my dad has like read this book on endometriosis and like knows what he's talking about now. Or, you know, my aunt watched the documentary about endometriosis. There's all these great resources out there now. So again, I'm focusing this on endo, but that can really apply to any chronic illness. Is like, you might be amazed by the way people do choose to show up for you. And those are the relationships that maybe feel even more valuable and are ones you want to prioritize. And then maybe there are others that just like, that energy is not feeling supportive. It doesn't mean that person can't be in your life. It doesn't mean they're not important to you.
Right.
But maybe that relationship shifts and that's also okay.
Yeah. Yeah. I think what's coming to mind for me right now is it's a way to ask for care, and that can offend some people. And those people probably like we should reevaluate what that relationship is like.
Yes.
I don't know. Just my 2 cents.
Yeah. No, absolutely.
Yeah.
And like I said, because so many of us are people pleasers, asking for help is really hard, but it's also really important. And this is something that has come up a lot in my endo therapy group is like, again, what are the systems for communication? Like, do I have to text you and say, hey, can you come over and help me do laundry? Yeah. Or do you have someone checking in with you being like, how are you? Is there anything I can do? How can I show up for you? What can I come help with? Right? Those are really different systems for communication.
Yeah, 100%. 100%. You need like a bat signal.
Yes.
I'm putting out the bat signal, okay?
Yes.
Maybe for some people that works,
Yeah.
Yeah.
And I want to add too, I think people can be wanting to help and wanting to support you and doing it in a way that's really harmful. Again, like toxic positivity is not something I want to hear. I don't want to get a check-in from someone and tell them I'm in pain and then say, well, it's all going to be all right and I'm sure you'll feel better soon. Maybe I will, probably, but when I'm actively in pain, that's not really what I want to hear from you. Right, I want to hear, what can I do to help? Like, can I bring anything over? Whatever it is, like, right.
Yeah, it's also, I feel like it sounds like a boundary within yourself as well, right? Like holding yourself to, no, this is the standard that I want to set.
Yes.
And so I need to advocate for myself. Yeah. All comes back to advocacy. That's like, it's hard. It's so hard to do that.
It is.
It's so critical.
It is.
Yeah.
Definitely.
All right. My last question is not like, it's kind of within the same vein, and I'm interested to hear how you answer it. But I didn't know that you were an art therapist when we met the first time. I didn't know that art therapists lived in the outpatient world, other than like in a context of like I have a friend who works at a women's shelter, like in those kind of contexts, right? That I didn't know that you could have your own amazing therapy practice.
Yes.
So how do you incorporate art therapy into your care of your clients, but also like tell us about art therapy.
Yeah, absolutely. Yes. Art therapy is everywhere. We are in hospitals, we are in schools, we are in outpatient therapy, we are in rehab settings, we are everywhere. Everywhere that you would see a mental health therapist, you could also see an art therapist. So art therapy is the incorporation of the creative process of creating art into the therapy setting. So again, based on what context you're in, that's going to look super different. But for me, that is incorporating art practice into my therapy sessions with clients. So usually that involves a client making artwork during a session. And that can be a great way to work through a lot of different things, work through emotions, whatever they're experiencing. Art is just a great tool for self-expression. So sometimes we get a little stuck in talk therapy, or there's limitations on how far we can get by talking about things. And art gives us another way to process. It uses the whole brain. When we're doing talk therapy, we're really only using one side of the brain over the other, or we might go back and forth, but art is like we're using the whole brain. It's almost a somatic practice in a way too, because it involves body. So it's a really great tool. Art therapy was actually my route into the therapy world. So I went to art school and I studied art therapy in undergrad, and then I went to grad school for art therapy and counseling. So, I always felt like art was very therapeutic for me. I mean, you see all these like art therapy coloring books and things out there, which by the way are not art therapy, but they are therapeutic art. Art is very therapeutic. You can do that by yourself. In order to do art therapy, you need to work with an art therapist. So that's like, I guess, my spiel on what art therapy is in general. But in terms of using it in my practice, so I kind of like to approach it that it's always an option on the table when I work with a client. So not all of my clients do art therapy. Some of them will do art therapy here and there. Some of them do art therapy every single session. It just depends on the person. But it really, I like to really think of it as like a partnership alongside the talk therapy session. So whatever big themes or patterns we're exploring while we're talking are also going to be coming up in the artwork, whether that's on purpose or subconsciously happening. So I sometimes I give a specific art prompt. We might do a little check-in. How are things going? How was your week? What was coming up for you this week? What felt stressful? What felt overwhelming? And then I will pair that into an art directive or a prompt for them to create, a visual. We can do it that way. Sometimes I also have people just doodle or create while we're talking. And that can also be really wonderful for people to, for me, at least as a creative person, I notice that when I'm making art, like I get more talkative, I get more chatty, like all of my inner thoughts and feelings start coming out while I'm talking. So sometimes it is just that there's so many ways it can be used.
Right.
It can be done in person. It can be done virtually. I do it both ways with clients. I work with teenagers and adults. Adults can do art therapy. A lot of times people think it's just kids. Anyone of any age can do art therapy. And some of the reasons, I guess, or the benefits to using art would be emotional expression, processing different experiences. So when we're thinking about chronic illness in particular, hospitalizations, medical trauma, other stressors, doctor's appointments, those are all things we can work through in art. We can work through physical sensations in art as well. So drawing that, mapping that out, exploring where that's coming from, what it looks like, sometimes can be really helpful for just like moving that sensation. We can explore trauma. We can explore past patterns or experiences, values, just kind of creating some meaning out of different things. And I also think it's cool to like, with chronic pain in particular, we can get into kind of a flow state through art. And sometimes that can be really interesting to see what impact does that have on the pain, because we can get really focused on something and we might not even notice our pain there. So that's another interesting way it could be used as well. So
yeah, I love that. Two friends come to mind. I have a friend who's in her 70s and she's been through so much in terms of like heart issues and all kinds of stuff. And she is an artist. She like has been keeping an art practice for a long time. And this was part of how she, processed all of that. Was, she'd have her project that she was working on, and then she'd show it to her art group, like, hey guys, like this is my journey of like what I've gone through here. She also does it through creative writing. So like there's a lot of interesting, and I feel like she's really centered herself with that. Which is really helpful. And then I have another friend who has lupus, who she's an artist, and she did a whole series on one of her hospitalizations that was just like really impactful, using some of the materials that she like, her hospital bracelet or like pill bottles or like the sheet that comes with the prescription, like that kind of stuff. And it was really, really impactful mixed media expression of like how she dealt with that and how she was feeling at the time. And I can see how that would be a helpful avenue for people to express themselves, especially when there's like an expression block, or like weaseling our way through,
And on that note, my grad school training was like primarily in medical art therapy. So I had 3 different internships, all in different medical settings. So one was at Children's Hospital Philadelphia, one was at a rehab setting, and then one was another like general hospital. But like seeing and I worked on primarily the oncology unit at Children's Hospital. So seeing kids like as they're inpatient, they're sick, they are not feeling good.
Right.
Still be able to bring this like light into their room with showing up with art materials. allowing them to just like process in a really developmentally appropriate way.
Mm-hmm.
I mean, that was really cool. And then, going into the like rehab setting, which was actually outpatient. The place that I was had an inpatient and outpatient facility.
That's
And
awesome.
so it was like a lot of people came from the inpatient to the outpatient, and they had been hospitalized. They'd had life altering injuries, brain injuries, spinal cord injuries,
Mm-hmm.
things like that. And like seeing just the power in, they they could not do a lot, but they were able to, we used like adaptive materials and things to
Mm-hmm.
help them be able to make art. And like it's so powerful how much of an impact art can really have on someone. And you talking about your friend made me think of that. Like, imagine if we're processing the whole time we're there and we're doing art along the way,
Mm-hmm.
and that is a
Mm-hmm.
space to process. And then you get discharged and you go home, and you're still able to go do art therapy, whether that's at a community art space or with an art
Mm-hmm.
therapist or even on your own. Like,
Yeah,
so many of those people would go home and like develop their own art practice, and like that was then their thing afterwards. Like
I
they
love
had
that.
this thing that just meant so much to them after they'd been through a lot. And I mean, it's really powerful. I'm not doing that kind of work every day now, but like I
Sure.
I know how much of an impact art can make.
Yeah, yeah. And that, I mean, we're both bookish people. And you've
Yes.
read the ACOTAR series, right?
Yes.
Yeah, yeah, yeah. I just think of like Sarah J. Maas on Call Her Daddy and
Mm-hmm.
talking about, oh, Nesta's book, as much as
Yeah.
people dislike it, I am a Nesta person. Anyway, moving on. We can have that discussion another time. But using that story to help her, like, process her own like struggles with depression and anxiety
Mm-hmm.
and dealing with her own birth trauma. Like that's
Yeah.
huge.
Yeah.
That's so impactful.
Absolutely.
Um and it's a part of ourselves that I think we are missing in general in
Yeah.
society,
Yeah.
because I can imagine like I feel like I even personally I feel like I could feel goofy
Mm-hmm.
doing an art prompt, you know?
Mm-hmm.
And
Yeah.
this year for me is embrace the cringe. That's been like, since July of last
Yes.
year, like opening this practice, like, yeah, you got to be a little cringy sometimes and you're going to be better for it. And that's okay.
Yeah.
And art is not cringy. I'm not saying that.
No, I get it. I
But
get it.
like that block of like, oh,
Yes.
I don't understand the point of this,
Yeah.
We live so much in our rational brain that we need to get into our like
Yes.
sensing and feeling and expressing brain.
When I, so most of the clients that I see in my practice are already creative people. They like art, they're
Mm-hmm.
comfortable making art, and that's why they come to me. But when I tell people in the general public that I'm an art therapist,
Mm-hmm.
I most of the time get the same response, which is like, oh, I can't do art. I can't draw. I
Yeah.
can't whatever.
Yeah.
Like it's that automatic, like almost
Mm-hmm.
shame that we like put on
Mm-hmm.
ourselves. And I think
Mm-hmm.
for so many people, there's this experience that happens when you're a kid, which is like, in elementary school, you take art class, everyone takes it, you're all like very mediocre,
Mm-hmm.
and no one cares because you're 8, right?
Right.
And then you get up to middle school, and then it's like you start to realize if you're good at it or not,
Mm-hmm.
and you decide to continue with it if you are, and if you're not good at it in the
Yeah.
traditional sense, you stop.
Right.
And then your creative development, at least when it comes to visual arts, like cuts off entirely because you're not
Yeah.
making art anymore. You're probably not drawing or painting on your own when you're in high school,
Mm-hmm.
unless you're in an art class, right? And maybe you have something else that's your creative outlet. But
Yeah.
so then coming back to that, it feels like coming home to your younger
Mm-hmm.
self. And
Mm-hmm.
that is like, that's the challenge, I think, for a lot of people. It's hard to do that. It's uncomfortable.
Yep.
Art therapy would actually be a great space to start that because there's no pressure to create something good. We're really not focused on the product. It's more so about the process of creating.
Mm-hmm.
And I think, if we were to throw yourself into like a painting class, you would probably feel really differently. That's really
Mm-hmm.
intense.
Mm-hmm.
There's enough stress around making art, even in this space or even by
Right.
yourself.
Right.
But I think doing it feels so powerful, and maybe
Mm-hmm.
it is like healing your inner child in a sense too at the same time.
Yeah.
But having that creative outlet is great. I think a lot of people I see getting into like crafting in some capacity, whether it's crochet or um, something along those lines. That feels, I think, a little more accessible. But mess around,
Yeah.
play, do
Yeah.
something like silly, and just like see what happens.
Yep. Yep. Or even, I mean, I think of like my mom is a big quilter, and her and my grandma
Oh
used to
yeah.
go to quilting retreats. And they, you know, I never went, but I'm sure that there was a lot of gabbing going on
Oh
and
yeah.
discussions about whatever. And like we need that again,
Yeah,
you know? We
for
need like
sure.
the creative outlet and the connection. And so I'm glad that this is a way for people to be able to
Yeah.
do both.
Yes. My
Yeah.
mon went to scrapbooking retreats. That
I
was her
love
thing.
it.
And I feel like
I
it's
love
probably
it.
a very similar group of people who go to
Yes.
quilting retreats.
I agree. I agree. I love that. I love
Yeah.
it. Well, thank you so much, Elizabeth. This was really enlightening, and I think it's really helpful for people who are living with chronic illnesses to hear from two people who also live with chronic illnesses and how they
Yeah.
manage them from different sides, the physical side and the mental side, but the
Yeah.
two things that are so deeply intertwined.
Yeah.
And I think PT and therapists should start acting like they are,
I know.
personally.
I know.
So,
We
yeah.
got some community partnerships growing here. I mean,
Yes.
I hate when it's like thought of as separate worlds. Like it's all so interconnected. We're all focused on healing the body, healing the mind,
Yep.
and the connection between the two.
Yep, exactly, exactly. So thank you for all the work that you do, and thank you for coming on today. Where can people find you?
Yeah, you can find me on Instagram at elizallen.therapy.
Love it.
Or my website is findcreativepathways.com. I see clients in person in Baltimore or virtually throughout Maryland, Colorado, South Carolina, and Vermont.
Love it. Wonderful. Thank you so much. Any final thoughts?
No, thanks for having me.
Of course. Great. Thank you, Elizabeth. Thanks for joining our conversation today. To learn more about Elizabeth and her practice, check out her website, findcreativepathways.com, or her Instagram at elizallen.therapy. Check back next month for another episode. As always, be well and flourish.